In this video, we're going to show you how to use the new CareLink Patient Online Self-Scheduling capability. For patients to be able to self-schedule online, you want to make sure the system is enabled. You can do this under Configuration System Settings, and you will see a module setting that says Enable Online Scheduling. You're going to want to make sure this is set to yes. By default, it will be set no to your account. If you want to enable this capability, please contact us at support@mymobilepracticemanager.com, or you can open a support ticket. Once this is enabled, you can integrate the online self-scheduling with your online website. And to do that, you can go under Configuration, go under Website Integration, and you will see the code that you can place on your website to allow for patient self-scheduling. And this code will create a button on your website. Your webmaster, web designer may be able to integrate it to look more specifically integrated with your own web presence. But once this is set on your site, your patients will have a link or a button here where they can go ahead and click schedule an e-visit appointment. They can go ahead and click on this. And once they do that, they'll be presented with a step 1 to validate the patient information. So to do that, they can type in a patient's last name and their date of birth. And they can also enter in a reason for a visit. We're going to say this is a test visit. And then they can submit step 1. And if the patient is found in your CareLink account, it will come back and say, yes, we found you. And it will ask the patient to confirm their patient address. This will be an address challenge. And it will show the patient's address as well as other addresses from your account. And the patient must successfully pass the address challenge. If they select the wrong address, they will be given one other opportunity to confirm their address. If they fail 2 times, they'll be prompted to call your office and that they're not able to self-schedule at this time. So this is the address for the patient. It will also ask that we confirm the patient's cell phone number. This will pull the cell phone number from the patient record. And then they can also confirm that they have consent to receive text messages, because once we go ahead and schedule the appointment, the patient will receive a text confirmation. So I can go ahead and click on submit. And now that we've confirmed the patient, we can select the provider we'd like to schedule with. We can also select the appointment type, and then this will show us the length of the appointment. So right now we have 2 visit types enabled for self-scheduling. We can apply different filters and limits to your provider list or your appointment type list. When you contact us to enable this feature, we will ask you the question, which providers and which visit types would you like enabled? And then we'll see the reason for the visit. And then we can search for available appointment times. And what this will do is look at the provider's schedule. It will also validate whether or not the provider has any appointments available. So it will look at whether there is a PTO day for your provider, whether the provider has met their maximum allotted appointments for that day, whether or not they have any time available that day. So it looks like today we have no available openings, but let's go ahead and try on Monday. It says we have some openings, so I can click on Monday, and then I can see these available times. They can go ahead and select on another day and see available appointment times for that day as well. So let's just go ahead and book an appointment for Monday. It will use the reason of test visit. We can change this if we want, but we're going to go ahead and book this appointment for 12:15. I'm going to go ahead and click on book. It's going to say, are you sure you want to book the appointment? I'll go ahead and click OK. And then it's going to return with a confirmation. Here is all of the information for the appointment. the patient name, date of birth, their contact information, and the scheduled provider, and the appointment date and appointment time. And then the patient will also receive a text confirmation that they have scheduled the appointment. And then when the patient is done, they can go ahead and close the window. So we're going to just confirm that the appointment was scheduled, so we can look in the patient activity log, and then we can see for this patient, Tyler Adams, we have a scheduled appointment. It should be for Monday, so we can go ahead and click on Monday, and you will see that we have the appointment scheduled at the selected time, and it will have our test visit note as well as the patient schedule note. So you can see that this appointment was successfully scheduled.